Hello, everybody. Thank you so much for joining us today. My name is Melissa Rogers, and I am the Director of Business Development for Heritage Property Management Services. Today, we have the privilege of hosting an event that affects all of us within our community associations as well as the industry itself. So just for quick clarification for everybody, because I'm sure everybody's curious, Heritage Property Management had previously scheduled this seminar to some extent with Craig Sears and Sears Pool for our associations during the calendar year already. And then once COVID-19 was introduced to all of us, Craig and I continue to have conversations about the possible impact that this was going to have on the upcoming pool season. So it was just really a normal blend for us to continue that partnership and be able to provide you guys the means of today's educational seminar. And so because we have the ability to live stream through Microsoft, we thought this would just be a great effort for all of us to hear the information in one place that will benefit all of us in the industry. So please know that this class is open to anyone and everyone who would like to participate. And people can still join us even right now if they would like to. This class, you're going to hear a lot of information that includes all of the active changes and updates that are just coming out rapidly regarding COVID-19, the latest governor's orders, and so forth that are going to impact the pool season for this year. The information that's being discussed today is in no means a supplement or an exchange for your attorney's opinion on your association's specific operation. So please keep that in mind. It is imperative that associations maintain open dialogue with their attorney and their management company for best practices and legal opinions. Please also seek out the CDC and the Georgia Health Department websites for direct support related to COVID-19. Lastly, this event is being recorded and it will be available for all of you who are attending today shortly after we end today's session. A few housekeeping rules just for us before we get started. All of you guys are in listen-only mode for today, so please feel free to submit your questions for the Q&A section a little bit later after Craig has had the ability to go through his presentation. The Q&A section is going to be on the top right-hand side of your screen. There's going to be a text dialog that says live Q&A. That's where you guys can go ahead and get your questions queued up for a little bit later. We do ask that you attempt to hold all of your questions until Craig has had an opportunity to offer his complete presentation. It's highly likely that he's probably going to answer some of your questions as he goes through his slides. So we certainly hope that you stay with us throughout the entire presentation. We're also going to be joined by a member from the CDC who has graciously offered her time for us in the Q&A portion of today's discussion. Her name is Michelle Havsla, and forgive me, Michelle, for mispronouncing your name if I have done that in any way, shape, or form. Michelle is very excited to share with us some of the information that she is getting so currently right now too, just as we all are. So thank you again for joining us today, and I am now going to turn this over to Craig Sears with Sears Pools. Thank you so much.
Thank you, Melissa. I appreciate that introduction. Thank you to Heritage Property Management for this opportunity. And as Melissa and I are of the same mind here, that this is, we don't care, well, I mean, we care, but we don't care if you use our services per se. This information is important for everyone. There's still a lot of uncertainty out there. And it's important that we try to come together and form some consensus. And so that's the main goal of what we're doing today. I'm blown away by the attendance today. So thank you, everyone who has jumped on the call. We have people from Georgia and we have people from all over the country. So obviously our focus today is going to be on what's happening here in Georgia. Some of that may apply in your area. Definitely not legal advice, as Melissa said. Also want to thank Michelle for her time on the call. And that's one of the main reasons I want to make sure we go through the presentation first so that we may cover a lot of answers to your questions in the presentation, and that we respect Michelle's time because she's obviously working on a lot of stuff right now. So without further ado, I guess let's go to the next slide. So just to start off with a recap, for some of you that are joining us who are in the industry and have been part of some of the calls that I've been on over the past few weeks, I'm sure some of this is not a surprise, but we need to kind of bring everybody up to a common base of where we are. As I believe everybody knows, Georgia schools are closed through the end of this school year. The governor's stay-at-home proclamation is in effect through the end of the month, and a public health state of emergency through May 13th. What just happened 2 days ago was the governor's made a reopen announcement where he basically feels that we are ready to enter phase 1 of the federal plan with details forthcoming. So that means that facilities like gyms and bowling alleys, salons can be reopening as soon as this Friday, restaurants and private social clubs as soon as next Monday. I want to caveat this by saying that just because you are allowed to do something doesn't mean you should do something with regard to opening. I think it's important that we look at all the guidance that we're going to be talking about in here, and really no one should be opening their facility until they have a plan for how they're going to be able to follow that guidance, and if there are violators of the plan, you know, how that's going to be dealt with as well. So case in point, I can tell you that one of the largest health club chains in the country, LA Fitness, had sent out notice today that even though they're allowed to reopen this Friday, they do not plan to reopen until May 1st. I've also heard from bowling alleys that they're assessing things. So not everybody is opening just because they can, and I think we need to consider that when we're looking at our pools as well. Also, where we are right now is swimming pool companies here in Georgia are providing essential services by ensuring that pools do not harbor pathogens and mosquitoes. We'll talk a little bit more about that in a little bit, but it's important to know that we can't just abandon our pools. We have to continue to maintain them. There's all sorts of things that can grow in pools that harm our health, and we don't want to be causing that in our communities. And then in addition to that, we don't want to have mosquitoes that can spread those diseases in our communities either. So where are our metro counties, at least in the metro Atlanta area right now? So Fulton and DeKalb have put a hold on all inspections until further notice. This is for your pool opening inspections. These are the two counties that are hardest hit by the outbreak. And so I think it's no surprise that they're putting that on hold. Cobb, Douglas, Cherokee, and Gwinnett are continuing to perform inspections. Not all of those are required. Gwinnett doesn't typically require a pre-opening inspection. The others typically do. So, and they are conducting those right now, and they're basically saying that let's go ahead and get the inspection done and then wait for further guidance before opening. In Forsyth and Paulding and other counties that are further out where there is no enforcement at the county level, that you pretty much have to fall to the state level. There's no inspection required from the county level there, but again, the recommendation is to wait for the governor's office and further CDC guidance before opening. Also, just as a baseline here, the water is not really what we're worried about. As long as you have chlorinated water in your pool, the CDC has stated that there's no evidence that the coronavirus can be transmitted through that. The primary means of transmission that we're really concerned about is airborne, secondary being surface contact. The CDC is actively working on guidance for swimming pool owners and operators, and we're hoping to have that by mid-May. So just to also keep that in mind as we head into pool season here. Next slide, please. So just to go over the federal plan for reopening, there is, and for those of you who watched the president's announcement, then you may already know this, but there's gating criteria that you have to meet before you go into each phase. And the gating criteria is necessary to pass before you can progress to the next phase. So our governor here in Georgia has decided, or based upon the data that he's evaluated, that he believes we're ready for phase 1. So that means that we have, according to him, met the gating criteria, which means we're seeing a downward trajectory of COVID-19 symptoms and confirmed cases over the last 14 days with continued testing. Hospitals must be able to continue to treat all patients without going and resorting to crisis care, and there must be continued robust testing for healthcare professionals. So whether, and I know this has been a very controversial call, we're not going to really get into politics on this here as far as whether you agree with the governor or not. The fact is that is what he has stated, and so we're moving forward with what he has stated. So that being the case, we're moving into phase 1, where vulnerable individuals should continue or must continue to shelter in place. When out in public, social distancing should remain, and groups no larger than 10 should be gathered together. Large venues and gyms can start to open with strict physical distancing. I noticed, for instance, in the press release from LA Fitness this morning that when they reopen, they're planning to require 200 square feet between each individual in their clubs, just to give you an idea of what they're looking at and how that may look when we're talking about reopening our pools as well. Next slide, please. Okay, so then phase 2, we have to meet the gating criteria again, which means we've got to go through that 2-week period of continued decline of those symptoms, and the hospitals must remain strong. They're not getting over capacity. Obviously, if we backslide here and the pandemic gets worse in our area, I think we're not going to get to phase 2. We're going to go backwards. None of us hope that that's going to happen, but just to be aware of that. So in phase 2, now we can meet in groups up to maximum size of 50. This is, I think, where we're seeing, it could be more realistic for when pools open and we're able to kind of hang out and see our neighbors again at the pool. Large venues can open with moderate physical distancing, and then finally phase 3, we have to meet the gating criteria again. And at this point, the vulnerable population may now interact with physical distancing, and the non-vulnerable population should avoid crowded areas. Next slide, please. So what are the recommendations for your community pool right now? Number 1 is continue the pool opening process as normal. This is because we don't know exactly when it's going to be safe to open, but if we halt the process, you're going to be way behind on opening. It typically takes anywhere from 4 to 6 weeks to get a commercial pool up and running, get it inspected and ready to go. So if everything is stopped and then the all clear is sounded, you could be looking at another month before your pool is ready to go, and your residents are not going to be happy about that. So we recommend you really should continue with pool opening process as normal. Make sure your utilities and services are activated. So that means, obviously emergency phones have to be activated in order to be ready and pass inspection. Trash service is one thing that sometimes is stopped in the off season and needs to be activated again. Those sorts of things. The goal is to be inspection ready and schedule the inspection as soon as able. So as I mentioned, some of the counties are already conducting inspections and passing pools. Others are on hold. We do want to keep those pool closed signs posted, and we recommend chain locking all gates to make it clear that the pool is not open for patron or resident usage at this time. Prepare your community for delayed opening and new operating procedures, which we're going to get into here in a few more slides. But go ahead and start the communication. Let them know that we are planning on opening this summer, but it's going to be delayed. By all means, do not open your facility before you are allowed by federal, state, and local guidelines. That's just not advisable, and you could also lose any insurance coverage that you would have there. As I understand from the insurance experts that I've talked to, most insurance policies have a communicable disease exclusion, and certainly if you do something as reckless as opening before recommended, and someone tries to tie picking up a case of this virus to your facility, your insurance is not going to be there to assist you. So you definitely want to proceed with caution on that. Covering your pool, which we've had a number of questions about that from clients, can we put the cover back on our pool? Well, we can, but there's extra cost to do that because everybody includes, one removal of the cover and one reinstallation of the cover in the fall. The labor cost there would be additional, and then you're going to cause a delay in your pool opening. And it's going to be very difficult to explain to your residents when the all clear is sounded and everybody wants to head to the pool, why you're going to have to wait possibly up to another month to get the pool prepped and ready. So we do not recommend covering the pool. Next slide, please. So what is pool operation for this summer going to look like? Well, we can expect bather loads to be significantly reduced in order to facilitate social distancing. Exactly what that means is probably going to depend on your facility, and this is where it gets difficult. We are waiting for additional guidance on that, but basically, from what we're hearing so far, is bather loads may be reduced as much as 50% or more from normal operating bather loads. One of the recommendations that is being discussed is spreading out the furniture, and that's going to vary depending upon facility as well. So these are going to be things that you're going to want to have discussions with your pool company about. What is the best way to set this up and to encourage that? Not to say that people can't move pool furniture, because they're obviously going to move pool furniture, but we certainly don't want to encourage it that way. One of the recommendations is to post new signage at the pool. The wording that's on this slide is wording that I came up with some consultation here, but it is not. Before you adopt anything, I would definitely run it by your attorney. But basically, we want people entering or thinking about entering the facilities to make sure and consider, should they really be coming into this facility right now? If they are experiencing any symptoms, they really need to stay home, and this needs to be communicated via all forms of communication to your members, as well as signage at the front gate. Disinfection of high-touch areas should occur daily at a minimum. That's coming from CDC. You may want to consider adding hand sanitizer stations or sanitary wipe stations in the pool to assist your members in keeping areas sanitary when they come down to the pool. Yes, I fully recognize that getting our hands on these materials right now can be quite difficult. And hopefully we won't have an issue with if you are able to provide them. We don't want people, stealing or abusing these supplies, because they're in high demand right now. But just something to consider in advance if you are planning to, or when you are planning to open. So more detailed guidance is expected sometime between the end of April and mid-May. The guidance may vary depending upon region, and also whether your facility is indoor or outdoor. As the president said, some states are going to be able to open up before others, and it looks like that's what's happening, certainly here in Georgia. And so we just need to be ready to take things, one step at a time, and what may work here may not work in another state. There also is a lot of discussion about indoor versus outdoor facilities. This is pertaining to a number of factors in the way that the coronavirus transmits from one person to another. Indoor facilities, we have a little more of a concern with trapped air and any droplets or aerosolized virus that could be lingering in the air is more of a concern in an indoor facility, say, as opposed to an outdoor facility, as well as the UV rays of the sun has been shown to, in some studies, to deactivate the virus. So obviously that's going to be a difference there between indoor and outdoor facilities. So a lot of these factors are being considered and discussed right now as the CDC and others try to come up with good guidance for us. Next slide, please. So here are some of the current CDC guidance for community facilities. There's not a specific CDC guidance out for community pools. So this is pulled from their website for community facilities. And at the end of the slide presentation, I've got a sources slide as well, so you can locate those and read these in more detail. This is just the highlights. So coronavirus can live for anywhere from hours to days on various surfaces, and it really depends on the condition. So we talked about indoor versus outdoor, different types of surfaces. There's a lot of factors there. It's unknown at this point really how long it remains viable in the air. When you are cleaning, you want to use an EPA registered disinfectant. Some examples include bleach, alcohol, hydrogen peroxide, ammonia, and there are others as well. It's good to note that for cleaning staff at the pools, there is a low risk of exposure so long as they're wearing PPE, which is personal protective equipment. And as we said before, you want to clean high-touch surfaces daily, more regularly if possible. One thing you may want to consider is if you have part of your facility where you have high-touch water features that are non-essential and you don't have a good strategy for how you're going to disinfect those, it's very difficult to get children to understand what social distancing is and touching surfaces. So you may want to consider closing non-essential high-touch features. So that may be things like, spray features, if you have a spray feature at your pool, at least until we get to phase 2 or phase 3. Next slide, please. So now let's focus on the staffing challenges for summer 2020. This is one of the biggest unknowns that the industry is facing right now. All of us are, if you talk to anybody in the industry, they will all tell you we're not fully staffed and we don't know when we'll be fully staffed. Our recruiting efforts were severely hampered when the shutdown occurred. Obviously, with school closures, we're not able to go to schools and recruit from there. Those of us who hire students on J-1 visas to come over for work and travel, it's very questionable whether or not they're going to be able to come this summer. We don't know due to travel restrictions and visa difficulties. There's just a lot in limbo there. Most of us have transitioned to doing online interviews, so that is a benefit of living in the day and time that we do. So we're all, I think, interviewing online. One of the best things that you as a homeowner board member or a property manager can do is to refer potential applicants to your pool company. Go ahead and just tell them to apply now, because I can tell you everybody's hiring, everybody's trying to staff up and train or get ready for this summer. The training process and certification classes have also been severely affected by the coronavirus pandemic. Pretty much nearly all of March and definitely all of April classes were canceled. May classes across the country are scheduled tentatively. The latest estimates seem to be that perhaps by mid-May we may resume training. Again, I believe that's going to be in a region by region decision, at least state by state, maybe even county by county. We're going to have to get to at least phase 1 so that we can gather in groups of 10, because a lifeguard class typically can have up to 10 people per instructor. So in order for those classes to take place, we have to be at least in phase 1. When classes do resume, class size will need to remain small, and most certifying agencies are recommending now a student to mannequin ratio of 1 to 1, whereas in the past that's been anywhere from 3 to 1 or 4 to 1 in some cases I've seen, just because mannequins are expensive but here we want to make it as safe for the students as possible. So that has a potential of slowing down the classes a little bit. Keep in mind that the pool management companies are going to need at least, and I really want to emphasize, at least 2 to 3 weeks to staff up and train once training classes can resume. There's still a lot of unknown, and we're still waiting for guidance from some of the certifying agencies to come out on how we can conduct classes safely. And we're hoping to have that within the next 1 to 3 weeks, depending upon the agency. Next slide, please. So what happens with our staff pools? Well, here in Georgia, most of the pool management companies that I've consulted with, including us, we have all agreed to credit our clients for unused lifeguard hours and attendant hours. That credit may vary. One thing to keep in mind is that we've already, like I think all pool management companies do, we've been recruiting since October of last year. So we have staff that are dedicated to that. That's their entire job, is to go out and find lifeguards for the following season, interview them and hire them. A lot of our recruitment process involves sponsorship, where we have to pay fees to schools to go in and recruit from there, or sports teams or places like that. And so all those expenses have already been incurred. And so I think what we're seeing is that, just as a heads up to clients, the credit rate going back is not necessarily the exact rate that you paid into the contract for that reason, because these expenses have already been borne. And personally, and I think most of our industry is not in a position where we want to be laying off any of our staffing, our staffing managers and admin staff to do this work, because we know that we're going to need them this summer. So the difference, or the delta there between those rates, really is covering expenses that we've already incurred and will be incurring. So I think we're going to be looking at one of these scenarios, and scenario C is kind of a wrinkle on scenario A and scenario B. So scenario A is, I think, the most desirable, and I'm hoping the scenario that we end up with here in Georgia, which would be a slightly delayed start of somewhere between 2 to 4 weeks. With that in mind, I think actually it could work out ideally, because I think it'll give pool management companies the opportunity to finish their recruiting and get their training set up and completed in time to be able to open the pools safely. Scenario B could happen if we see a backslide here in Georgia and the pandemic worsens, and we may be looking at a 5 to 8 week delay, and we may be looking at not opening pools till July or sometime in July. I certainly hope that doesn't happen, but I think it's worth discussing with your pool management company if that does happen. How do you want to proceed with your lifeguard and attendant hours? There are some different options there. Some of the options that we're going to be talking about with our clients are, if you would like us to guarantee that we're going to have staff for you the latter half of the summer, you might want to consider not asking for a credit from the first half of the summer and having us going ahead and paying the staff for the first half of the summer, so that they don't go off and get other jobs and they're not available for the second half of the summer. So that depends, again, on a facility by facility basis decision. Scenario C could happen with either scenario A or scenario B, and that's where a community may say, you know what, there's just too much uncertainty here. We're not a heavy use pool. We probably don't need our lifeguards. Let's talk with our pool company, and maybe we'll just cancel. We'll go without lifeguards this season. If that's something that you're thinking about doing, obviously you need to make sure that you do have so much your own risk coverage to do that. We recommend that this is only for facilities that have no diving boards or slides, and shallow water only, and that's really more of an insurance thing, because it's going to be hard for you to find insurance if you have deep water diving boards or slides and no lifeguards. So if you're going to look into making that decision, I would say consider your insurance, consider your patron usage, consider the need for increased maintenance. Without your lifeguard or a pool attendant there, somebody's going to have to check on the pool more often to make sure that surfaces are getting disinfected and people are not violating the distancing protocols. Scenario D is pretty much the worst case scenario, where community pools are not allowed to open. I don't believe this is going to happen, but if it does, or if the community feels that they cannot safely open the pool for the summer, then in that case, you would obviously get a credit for your staff, but the maintenance has to continue in order to prevent your pool from becoming a health hazard. Next slide, please. So how is staffing pools going to change in 2020? Well, as I mentioned before, we're going to be expected to socially distance within the pool area. How much social distancing is still to be determined. So it's only natural to expect that lifeguards and attendants may need to help enforce that. However, we've got to keep in mind that for the lifeguards role, their first priority has to remain patron surveillance. So they've got to be looking for potential drowning or dangerous behavior that could cause injury or death, and addressing that first. And then if they're able to blow their whistle and break up groups, then that's great. There's been a lot of discussion about whether or not lifeguards and attendants should wear masks while on duty. And that hasn't really been parsed out yet, but and this is not legal recommendation by any means. My personal opinion is that lifeguards should be able to wear a mask at their discretion. I think that different circumstances will call for different protocols. If you're at an outdoor pool, if you're on an elevated station away from others, it's more than likely you're in a position where you could work without a mask. There's definitely concerns with if you are working with a mask, it's going to make it difficult for you to use your whistle. It gets pretty hot here in Georgia in the summertime, and wearing that mask is going to be uncomfortable. And it could start to fog up your sunglasses. So if it becomes more of a distraction and an irritation, then my concern would be that the mask is actually hindering your ability as a lifeguard to perform patron surveillance. So, but these are going to have to be taken on a case-by-case basis, and this is still being discussed. Another thing that's being discussed is potential temperature checks. If you can go back one slide, at the entrance, and that would be, oops, if you can go back 2 slides now. This may be something to consider. Really, if this is gonna be considered at your pool, you would need to have a pool attendant or a pool monitor sitting at the gate. In those cases, I would recommend that person be wearing a mask, and you could have them check people's temperature and make a determination whether or not they could come in. CPR protocol, really, we really can't change CPR protocol from the standpoint of needing to be able to give breaths, because in drowning victims, breaths are absolutely essential to preserving life. Fortunately, our lifeguards all carry breathing masks with them with one-way valves, so that the air breathed out from the lifeguard goes into the victim's chest, and air coming back out from the victim should not go to the lifeguard's mouth. Or, of course, in an emergency situation, anything could happen, but we have personal protective equipment for our staff. This is one of the reasons why it's so important that we really don't want any patrons coming to the pool who are experiencing symptoms. Obviously, we know that there can be people who are asymptomatic as well. There's not a whole lot we can do about that, but certainly people who are symptomatic, we want to discourage them from coming to the pool by all means. Okay, next slide, please. So, questions that we're getting about credits, I broke these down into 2 categories. So from clients to the pool companies, what kind of credit can I expect? So at this point in the season, maintenance costs are the same. Pretty much all of our labor costs, chemical costs, fuel, insurance, everything is the same as it would be on a normal season. If we go to a worst case scenario, such as scenario D, where the pool does not open at all, it may be possible that some pools could be eligible for a slight maintenance credit. That's going to really depend on what the situation is there. Let's say, for instance, if your pool company's contracted to come out 3 or 4 or 5 times a week to maintain the pool. Well, if you're not going to be opening the pool, probably don't have to come out that often, just to prevent the pool from turning into a green mess of potential pathogens and mosquitoes. So there might be a little bit of a credit there, but for the most part, maintenance is going to need to continue. We're still going to recommend not to put the cover back on the pool, because if you do put the cover back on the pool, it creates almost like a greenhouse effect where it heats up the water. And with the warmer water, it can be very difficult to prevent algae blooms, and it's going to be difficult to keep the pool sanitary and safe during that time with the cover on during the summertime. And then, of course, staffing costs would be reduced per one of the scenarios A through D. Consider that there again, if you eliminate either all or a portion of your staff, that there may be a need to increase the maintenance side of what you're getting from your pool company too. And then we've also received some questions from non-mandatory HOAs and private clubs. This is a difficult spot. You know, they're getting questions from membership that they're saying, well, if the pool doesn't open till July, are you going to prorate my membership by 50%? We are recommending that you not do that, and just explain to the membership that, you know, as an association, you're a small business too, and you rely on those membership fees to cover your operational expenses. Membership is for the season, regardless of length. And your amenities have basic upkeep expenses, whether they open or not. And you could give them an example of, you know, you may have one summer where you may have thunderstorms for 6 weeks out of the summer, and another summer where you only have thunderstorms for 2 weeks. Nobody gives credits for that. These are environmental factors that are beyond all of our control, and hopefully people can understand that, and hopefully they can appreciate that and continue to pay their membership dues. Next slide, please. So in conclusion, we are very optimistic for a 2020 pool season. This is a fluid situation, pun intended. Be prepared for change. Prepare your membership. Communication is key. Go ahead and take some notes from this presentation. Let your membership know how you see things shaping up this year. Talk with your pool company. Partner with them to make sure this is a successful season. Obviously, you need to continue to maintain your pool no matter what, and contact your state elected officials if you have an opinion on how things should or shouldn't be handled, or if you have an idea of something that should be incorporated into best practices. Feel free to reach out to your state elected officials. You can also reach out to your pool company. You can reach out to the Pool and Hot Tub Alliance. That is our trade association. And they work with state and federal officials to help come up with best practices. And they have already released a number of things that are continuing to work on others as well. So these are folks that you can reach out to and help shape a more positive summer. So let's move on to the next slide. And in case you're wondering and you're looking for the latest trends in fashion swimwear this summer, the CDC has released their summer swimsuit collection. So feel free to start shopping now. I'm sure Michelle can answer questions on that later. Just kidding, of course. All right, I think we have one more slide. So here's our source slide. There's various sources on here directly from the CDC, the Department of Public Health for Georgia, and the PHTA Corona update page, which is also updated regularly. That's the trade association that I mentioned to you. And also feel free to follow Sears Pool Management on Facebook and LinkedIn. We're very good about keeping up with current events and posting current events. And at this point, I will conclude the presentation and welcome questions to either myself or Michelle.
So Craig, go ahead and take a look at the live Q&A on there. I've been staging some questions that we've got over here. We've got a few now. Really quickly, everybody who's on the call, we will go ahead and send out a copy of the slides as well as the recording today. It will be later this afternoon, if not this evening, so please hold tight. We're getting a lot of questions about that. So now is a good time for all of you to go ahead and submit any questions that you have that maybe Craig has not had an opportunity to address for you. Craig, can you go ahead and see the questions on the side? And I figured you just want to go in order.
Sure. Yeah, these are some great questions. So what is your opinion on operating pools for sunbathing only, no swimming? I think, honestly, you know, when people are in the water, that's less of a risk of transmission. If they're sunbathing, that's actually technically riskier than being in the water. So so if you're going to open for sunbathing, you might as well open for swimming, and would be my opinion on that. Excuse me. The next one is, where do we get PPE? Great question. For our staff, we'll be providing gloves and masks. But as far as the general public and the clubs, that's going to be difficult to perhaps source. But we are working with our normal suppliers. We hope that additional supplies become available soon. Will lifeguards have training in enforcing social distancing? Great question. Yes, we are going to be discussing that in our online orientation for the guards this year, based upon the best practices and the guidance that comes out from the state and the CDC. Basically, how we see that going is that the lifeguards will be able to blow the whistles, tell groups to disperse. If they do not disperse, then they will have the ability, as with any other sort of situation that can get out of hand at a pool, to call the police. And we've actually had at least one health department tell us that because social distancing is going to be kind of difficult to enforce, particularly at pools without staff, violations of the social distancing procedures and protocol are going to have to be self-policed and self-reported. So if you see groups at the pool that are behaving recklessly, call the police. The police will come out and give warnings initially, and if it continues with repeated violations, then citations may be issued. Any guidance on use? Let's see. Any guidance on use for cleaning restrooms? Yes, our staff would have personal protective equipment for that. I would definitely consider, if you don't already have this, supplement with a maid service. A professional maid service this summer would be a good way to go to help keep your pools clean. Next question: for HOA pools with no staff or lifeguards, who is liable for anyone who contracts COVID-19 at the pool, and how do we maintain disinfection, sanitizing, etc., and social distancing between users? So the social distancing, as I mentioned, would be self-policed. As far as sanitizing, you can provide if you can get your hands on it, sanitizing wipes and hand sanitizer for residents. That's going to be difficult. It's a lot of this is going to have to be self-policed, I think, is what it comes down to. And that's where communication is really important, that you've got to make sure that your residents know this. And just like for any other type of inappropriate behavior at the pool, they can get banned for, public displays of affection or whatnot. They can get banned for violating this as well. So this is where if you have an access control system like key fobs, you can deactivate people for breaking these codes or breaking these protocols. That would be my recommendation there. Suggestions on how to respond to members on why we are following CDC recs when governor and president are not. Okay. Oh, I'm sorry. And let me back up too. There was a question about liability. If somebody were to say they got COVID-19 from the pool, that's probably an attorney and an insurance question. It may be difficult to trace that to the pool unless you've got a group of people that all got sick and were all at the pool at the same time. So and then is it going to be, did they get it because they were standing too close to somebody who was infected, or did they get it because they touched an infected surface? Right now, and I think we still believe the data seems to say that, person-to-person transmission is the more likely candidate in most cases. Particularly, I would think if it's an outdoor pool where you're less likely to, the sunlight is there to help deactivate as well. Let's see, will it be enough to only post guidelines and requirements if no one is present to monitor and enforce them? I don't know. I don't know. That's a great question. Will this presentation be made public? It is being recorded, and we will be posting it. Craig, do you have any pools that have USA swimming teams? And if so, are you working with coaches on how they can design their workouts? Great question, Sue. We do have a lot of pools with swim teams. Most of them are Summer Lake swim teams. I think we have one or two with year-round swim teams. I have not heard a whole lot of guidance there yet. I do know at least one swim team, the swim team that my kids are on, has said that they are holding off. They're going to wait another between 1 to 3 weeks and see how things progress before getting back in the water. But that's all I know about that at this point. At the present time in Fulton County, I understand we should not open until Fulton County inspects pools. That is correct. Do not open until they inspect, and until we are clear to open. Let's see, just to clarify, a neighborhood pool in Cobb County can request inspection and open at will. Well, a neighborhood in Cobb County can request inspection, yes. It is not recommended to open at this point. Our recommendation on that right now would be to wait at least until the end of the public health emergency, which is the middle of May right now. And then we really need to keep an eye on how things are progressing there. We have a non-staff pool in Fulton County. Is someone there to wipe down common high-touch surfaces regularly? Definitely recommended. Or do you think we would be okay to disclaim all risk? We are already swim at your own risk. Great question. That would be a good one for your HOA attorney. Obviously, you definitely want to disclaim as much risk as you can. Adding somebody there is just a matter of cost and budgeting, and if it's feasible. When you speak of guidance and shoulds, that is different from laws, correct? Great question, yes. So the CDC is not a regulatory agency. They are not creating laws, they're creating guidance. Similarly, the PHTA, Pool and Hot Tub Association, or Alliance rather, is creating guidance. Those are best practices. So if you're following those best practices, you're less likely to be, in trouble for something. But as far as what you can and can't do legally, that's going to be coming from the governor and your local municipality, which is in most cases your county around Metro Atlanta. Does Sears install or maintain sanitizing stations? If not, can we provide names of suppliers of that equipment? Great question. Yes, we are looking at doing that. We've been discussing with our suppliers. It's a little bit tricky, but we're trying to line up some suppliers to do that, and hopefully we'll have a response on that maybe, I think, by Friday. Let's see. Is the criteria that you stipulated, phase 1, phase 2, et cetera, state mandated or industry guidelines? So the phases are part of the federal reopening. And basically, our governor has said that he believes we're ready for phase 1. Any discussions on having swimmers sign waivers? I mean, you can have waivers. I know that we've got a number of attorneys on the call as well. So I would say that's really more of an attorney question there about waivers. How far in advance do we have to let our oh, that question disappeared. If we do open in May, are we able to tweak our schedule for the month as online test dates for schools change? I'm not sure I fully understand that question, but we're going to be, the way we're planning to operate is continue to open and maintain your pool as if it was opening to your residents. We don't know exactly when we're going to be able to actually open it, but that's our plan. To verify, at this time, the governor has not provided info on lifting restrictions. That is correct. I did hear from someone at the governor's office today saying they are working on more specific criteria and guidance there, but basically, as it stands right now, their recommendations are standard social distancing under the phase 1 level that he says that we're at. What is the possibility of eliminating all furniture except on a request basis? That's a good question. I don't think you're required to have furniture there, so that would be a personal preference if you want to eliminate your furniture. I've been hired as a lifeguard for this summer. I haven't taken the lifeguard training class yet. If I sign up for the class but it is canceled, will I be reimbursed? Yes, if the class is canceled, you will be reimbursed. Right now, I do not expect any classes to be canceled. I only expect them to be rescheduled. We'll probably have to push them back from when they were originally scheduled. Swimming only or lounging, I think we've covered that one. Would it be prudent to leave regular chairs and lounge chairs and store tables in order to reduce surfaces? Yeah, that you could do that. I think I would not cluster all of your tables in one area because that's going to really be a problem for social distancing. But I think you're still going to probably have families that come down to the pool and want to sit together and eat pizza or burgers. And so I would say for that, you may still want to have some tables out. Do you recommend any resources for obtaining safety equipment, hand sanitizer, wipes, gloves, masks? I'm working on suppliers for that, and I can tell you everybody's shorthanded right now on that stuff. If you find one that's got a good stock, please share. How long does it take for algae to regrow if we decide to recover the pool? Well, that's really a function of how hot it is. Could be anywhere from 1 to 3 weeks. I would think you could have an algae bloom, even with running the pumps. Will Sears have a suggested signage available for communities to purchase? Yes, we are working on having that signage available to clients. Is a neighborhood pool swim at your own risk subject to the state mandated guidelines? If so, who's responsible for compliance? So yes, all of our pools fall under the state guidance. Some of them, if you're in a county where they enforce their own rules, then you're going to have to go by that county. They're going to be more of the enforcement arm than the state. Do you have any recommendations for encouraging or enforcing social distancing? That's a tough one. Some people are looking at, some people already have cameras in the pool area, and that idea has been brought up, but I would definitely consult with your attorney before doing that because there's issues as far as, you're in a public place, so it's not necessarily an invasion of privacy, but how cameras are handled, there's a lot of legal issues there. So that would be one thing, but then a way you could possibly manage it, but I would consult with an attorney on that before using that as a control method. Do you see an HOA who does not have staff being able to open their pool? Yes, I think that you can. I think that if you've got the proper protocols in place and your residents are following those protocols, I think that you'll be okay to open. You may have to ban some of your residents. There may be some residents who just can't follow rules, and you have to ban them. Do you feel if there is no attendant in our pool and we are swimming at our own risk that we should not reopen until all restrictions are lifted, as we have no way to really enforce them? That's probably going to be an individual association decision. And I would say, talk to your pool company about that. If we're your pool company, we'll be happy to discuss that. It really depends on factors and what phase we're in. If in a construction phase and there's a difference in inspection schedule, will they do these first or do the existing pools? I'm not sure I understand that question, but the construction inspections and opening inspections are different inspections. All construction inspections must be passed first, and then an opening inspection will occur. How do we feel about lap swim by appointment? So I think that's a great idea. I think some people have reservation systems for their tennis courts, and they could possibly adapt that for their swimming pool as well. So that's certainly something that could be a strategy to help you manage bather load at the pool. Communities with small gyms, do you recommend keeping them closed? I would say right now, yes, I would recommend keeping them closed. I would consult with your attorney on that as well. And I would probably say, wait until we're at least in phase 2 before opening your neighborhood gym, because those are going to be harder to sanitize than a public gym because of staffing. Let's see, how to find pool deck capacity. So that's going to depend on your county or state code, and we can, if we're your pool company, we can help you calculate that. Whoever your pool company is should be able to help you with that. And as far as what the final bather load capacity is going to be, there's going to be calculations that we have to look at as far as water space as well as on the deck. But I think what was suggested or mentioned earlier, and I like this suggestion, is when keeping in mind bather load, we need to think about, if an emergency happened, and this is for staff pools, and a lifeguard had to get in, clear the pool, get in and perform a rescue, is there enough space on the deck where everyone could stand socially distanced safely? And if that's the case, then you're probably okay with your bather load. Will information about online orientation be sent out soon? Yes, we should have that hopefully by, you should see information about that hopefully by next week. Based upon my understanding, we should not open the pool at this point until instructed to do so from the state or federal government. That is correct. I would not recommend opening right now. What do you think about swim teams for summer? So I think swim teams are great. I love swim teams. I grew up on swim team. It's going to be hard for swim teams this year to socially distance at swim meets. I don't know how that's going to play out just yet. I did speak with one gentleman who's in charge of the largest league here in the metro area. He said they are looking at doing, I forgot the term, but let's say virtual meets, where it would be kind of like time trials, where your home team swims, the other team swims at home, and then you compare times, and places are judged on time, not necessarily coming together at the meets, because as anybody who's been to a summer league swim meet knows, it's very difficult to socially distance at a summer league swim meet. Will Sears be able to get hand sanitizer stations if a board requests them? Yes, we are working on that. I can't guarantee it right now. We're hoping to have an answer by the end of the week on that. Who will give the official all clear to open if we do not need an inspection? So that's going to come primarily from the governor, and we would also, if you're our client, we'd be happy to consult with you as well. Would a good option for pool furniture be to not put out any? Yeah, we talked about that. That's possible. Assuming phase 1 opening of pools, am I correct to think that we must post a 10-person limit to entering our pool? So I think it's 10, and maybe Michelle would be able to answer that. But my understanding of the social distancing is no larger than groups of 10. So if you got 10 people that are kind of standing in close proximity, that's a group. But I don't think we're talking about 10 people total in the entire pool area. But I could be wrong about that. Michelle, I don't know if you want to weigh in on that one, if you're still on the call. Okay, we may have lost Michelle. Can we just put swim at your own risk? We don't have a lifeguard, and if it's safe enough to open, gyms, then a private pool should be less of a threat, shouldn't it? Theoretically, I guess. I'm not sure I fully understood the question. What do you recommend to wash down furniture and decks? So any of the disinfectants that were mentioned earlier in the presentation are all registered as disinfectants through the EPA and would be effective. We talked about pool furniture already. If we found funding for an attendant, could we wind up required to have a lifeguard going forward? So the question is, if we find the money and we pay for an attendant this year, will we be locked into that? No, you would not be locked into that that I'm aware of, unless there would be some regulation change, but I'm not aware of that. Are these guidelines for all size communities? Yes, they are, and that's, I think, Michelle could speak to that as well, that basically every community, it's hard to write guidelines for all communities. You're going to need to take the general guidance that CDC puts out and others put out and interpret that the way that it makes the most sense for your community. Is it safe for a lifeguard to wear a mask when entering the water? Can the mask get wet? So good question. So our uniform supplier is creating masks for lifeguards out of a lycra material, which is like a swimsuit material. So yes, it would be fine for that to get wet. Realistically and logistically, I would think it'd be in the lifeguard's way of performing the rescue. So I would think that they would probably take it off before they got in the water, but that's up to the lifeguard. Realistically, do you see there being available guards for the season if we were to extend into September and October? That's a great question. It's probably too early to tell right now. What if we open pools and then there's another COVID outbreak? Okay, that's a great question. I think my understanding is we would go backwards through the stages. We'd get knocked back to pre-stage or pre-phase 1, and we'd have to start over again. So we may have to close. Hopefully that's not going to happen, but that would be my take on that. Michelle may have more on that. Pool signage was mentioned, highlighting CDC recommendation. Will Heritage or a pool company provide options to purchase a sign? Excuse me. I think right now, I'm not aware of anybody commercially producing the sign because there's still a little bit of discussion going on about what the official wording should be. So I think once that's decided, I think you'll see people coming out with signs that are hopefully pre-made and ready for distribution. But that may be a few weeks. Let's see. We are currently servicing. You're currently servicing our pool. We're leaving. We have the cover on, mainly to prevent patrons from being tempted to access. How long do you think it's safe to leave it on? So, I mean, keeping your cover on your pool is obviously going to keep people out of the pool. The temperatures right now are fairly mild here. We're seeing highs in the 70s. But if we start having getting up to the 80s and 90s, it's going to be difficult, if not impossible, to prevent algae blooms in the pool. So, I would say that, chain lock the gate and use that as your primary deterrent. Let's see, are there additional items we need to add to our standard first aid kit supplies? Great question. I would say extra pairs of gloves would be good, and masks may be good as well, if you can get your hands on them. If pools are not open, will the staff still get paid? So that's a great question. We talked a little bit about that earlier under scenario C, or scenario B, and whether or not that would happen. That's going to probably be a community by community decision, at least the way that we look at it. Other pool management companies may look at that differently. Our HOA doesn't have attendants or lifeguards. We're at your own risk. Suggestions on signs, cleaning services, etc. That's basically the suggestions I have are kind of what we've covered so far. We're hoping to come out with more specific suggestions and guidance. For phase 1, when limiting to groups of no more than 10, should we open the pool? Is that technically anyone at the pool? I think we covered that. I think the main thing is we want to have people that we don't want to have groups larger than 10, and we want to have people at least 6 feet apart. So depending upon how much deck space you have and how much water space you have, that you have to interpret it based on that. Is there a possibility of your providing staff that are not necessarily lifeguards but can take temperatures? That would be an attendant or a monitor position. Yes, we do provide that. Will we have staff available for that right now? It would depend on where you are and what you're looking for. We would have to take that on a case-by-case basis. What do you suggest for pools with no lifeguards? I think we've talked about a lot of things for that. Let's see. So we didn't talk about bathrooms with regard to social distancing. Yes, good question. So probably it depends on your bathrooms, but you may want to say one person in the restroom at a time, male and female. That's depends on what type of bathrooms you have, how big they are, and so forth. What about pools with volleyball or playgrounds? Okay. So I would say that's pretty much like tennis courts. Right now, USTA recommends that tennis courts be closed. With things loosening up and headed into phase 1, could you play volleyball in a group less than 10? Yeah, you could. So maybe that would be okay. If there are protocols, or is there a protocol if someone who used the pool is found at a later time to test positive for COVID-19? Will they need to close the area with a certain time frame of disinfecting? So that's a great question. I'm not aware of a specific protocol for that right now. I would certainly recommend if that does happen. If we're talking about we find out 3 weeks later, I don't know that it's going to be that helpful to do anything at that point. But if we're talking about it happened yesterday, then yeah, I would think you might want to close down and disinfect. And Michelle may have a comment to that as well. I don't know. Michelle, are you still on the call?
I don't know that we've ever been able to get Michelle to join the call, so go ahead and continue.
I see. Okay. Well, I see her showing as on here, but I think she's on mute. I see her link, but anyway, okay. Can you send out a link that we can post to people to apply for lifeguards? Absolutely. Contact us or contact Katie, our staffing manager, katie@searspool.com, and she can send you the link directly. How will we know when to open? Talk with us. If you're our client, talk with us or talk with your pool company on a regular basis. Does social distance rules apply to patrons when in the water? That's a great question. So, if you're swimming under the water or swimming next to somebody in a lane, I don't think there's a big concern. If you are roughhousing in the pool with people that are not in your immediate family unit, there's a possibility that you could be breathing each other's air, and there's some risk there. I would say it's probably low, but I would say if you can, social distance in the water as well, but I would say it's more important on land than it is in water. Certainly from a touch standpoint, with chlorinated water, we're not worried about that. What role do you see any association or HOA should take if the bather load of the pool is reduced down to 75% or 50%, and we see a situation where lines are forming at the entry point of the pool facility? That's a great question. Well, if that is happening, hopefully those individuals will socially distance in the line. It's pretty much the same as social distancing inside or outside the facility. If they are on HOA property and they're either following social distancing protocol or they're not, whether they're inside the pool or not. In your opinion, do you believe that a pool area should be closed throughout the day for a more in-depth closing? I think they mean cleaning. So I think it's a good idea. It never hurts to clean more. I think it's also important to note that there's no guarantee that you're not going to pick up something at the pool, even if it's not COVID-19. When you walk into any public facility, there are other things you can pick up from surface contact or close breathing with someone who's sick with something else. So there's nothing we can really do to take away all risk. Should we work with lawyers to draft a member sign-off form covering things like not attending the pool if they have symptoms? Possibly. That would be a question for your attorney. That's kind of a waiver question. Some attorneys are more in favor of waivers than others, and how effective they are. I would defer to them on that. Where would we buy the mask if we need them? I'm assuming this may be coming from a lifeguard. If you're working for us, we have a link to it in our, we'll have a link to it, I think this week. I'll have to ask Katie on that, on our uniform ordering page. Our pool is not monitored. When we open, the residents will go to the outdoor pool on their own. Is a sign about the COVID virus enough to protect the HOA? Well, it's certainly better than not putting the sign up, in my opinion. Can anybody sue anybody for any reason? Absolutely. Will they prevail? That's another matter. The more steps you can take to prepare and inform, the better you'll be. Let's see, will there be a need to restrict children and age groups from the pool and restroom facilities? Good question. I would definitely encourage children or parents with young children to make sure they are accompanying their children to the restroom. This is an issue even during regular seasons without COVID-19, where unaccompanied toddlers go to the restroom and make a mess in there, and mom and dad are out on the pool deck. So I would definitely encourage that. How would we determine? I'm sorry? Oh, is that Michelle?
This is Michelle. Can you hear me? Yes. Oh, gosh.
Yes.
I think I finally figured this out. Sorry.
Okay, great. Yeah. Did you want to comment on something?
Just with the kids, we are not we have not considered age restrictions. According to the Housing Act, the Family Housing Act, you usually can't prohibit a certain age group from coming into an area, at least in a non-pandemic country or state of being, I should say. But if we were to do that, if we were to consider that, I would say like all elementary school kids would be banned from going to school. Like you would have to do it across the board. You probably wouldn't be able to do it specifically to the pool.
Mm-hmm. Okay, yeah, thanks for jumping in on that, and definitely mentioning FHA, because that is a concern. We have to be careful about how any rules are written related to age. How would we determine the number of people permitted in the facility if limitations are needed? Would the length of time people stay need to be limited? Are these measurements needed in outdoor pools, in your opinion? Really depends on how popular the pool area and how large of an area you have. I mentioned earlier using a scheduling app. You may find if your pool is extremely popular, that may be a way for you to manage, how much time each family has at the pool, and you schedule it just like you would schedule use of a tennis court. If we are in phase 2, then does that mean that groups of up to 50 could sit together at the pool decking, just anticipating arguments of teenagers? That is my understanding. Michelle, did you want to comment on that as well?
It's really about people staying within at 6 feet or more from people that they're not in the same household as. So no, teenagers from different households cannot be less than 6 feet from each other.
Mm-hmm. Okay, thank you. Let's see. Will info about online orientation be sent out soon? Yes, we covered that. There has been reports that COVID can live in fecal matter for a long time. Will the CDC be putting out any new guidance for fecal incidents? I'll let Michelle handle that.
Our fecal incident response recommendations aren't going to change regarding COVID, because we're talking about something being aerosolized, us inhaling the feces / COVID virus. So one thing, that's actually what you said earlier about the pools. Right now, there is no evidence that swallowing pool water or any other kind of water is going to be transmitting coronavirus. On top of that, in pools, hot tub spas, water playgrounds, you have the added benefit of chlorination. We are looking potentially at lakes. This is more in EPA's purview, and coastal waters, and whether there's an issue there when waves are made and water's aerosolized, and potentially if there's a sewage spill or something into the water, is that an issue? EPA is looking into that, but right now, a pool, especially a well-operated pool, should not present an issue, and fecal incident response recommendations will not change.
Cool. Thank you. Next question is, what if we open pools and there's another COVID outbreak? Do we restart the phases? My understanding is we'd go back to, pre-phase 1, and I would imagine that the governor is going to have another proclamation at that point. But yeah, we may have to close if things get bad. Michelle, do you have any other feedback on that? Or?
No, that sounds right to me.
Okay. Next question is this information just for homeowners association, or does it apply to public pools as well? At least here in Georgia, pretty much all commercial pools, I think, fall in the same area, whether it's a homeowner association or whether it's a city pool. I think the way we look at this is that these are across the board there. Next question, we are both swim at your own risk and guarded. Can we open for individual lane swimming, but not to the general neighborhood? Probably, yes, you could do that if you wanted to. It's legally okay to restrict the pool for a designated usage like lap swimming, but it's not legally enforceable to restrict it to like a designated age group, as Michelle mentioned earlier. Is your pool on an access, or if your pool is on an access system, do you still recommend putting a lock and chain on the gate? At this point, yes, until unless you can deactivate everyone's key fobs until you're ready to open. So, but the main thing is we just don't want people thinking it's okay to go in right now. If we have a contract with you and you're in Gwinnett, which doesn't require pre-opening inspections, will you let us know when it's okay? How will we know when we can open? Yes, we will be letting you know when that's okay. How far in advance do we have to let our management company know that we do want to open, assuming we are continuing with opening maintenance? I would say the sooner the better. If you're, our assumption is that all of our clients want to open unless we hear otherwise. Anything? I'm not sure about that question. Okay, where? Let's see. Is there scientific proof that hot weather kills COVID-19? I'll let Michelle take that one.
So we do know that the sun inactivates or kills the virus pretty quickly. Basically, that's kind of where the thinking is coming from when you hear that it's going to disappear this summer. I don't know that I agree it's going to disappear this summer, but that's kind of what that is based on, that when the virus is exposed to sun, it's very susceptible and it will be killed. The other thing, it's really coming down to the spacing. I cannot emphasize this enough. It's about you don't live with the person, or the way we're kind of framing it, if you can hit them with a pool noodle and they don't live in your house, they're too close.
That's a great test. Okay, let's see. Another question about if guards will be available later in the season. I think we covered that, but that's unknown at this point. Are there any type of current pool kits that would help identify asymptomatic or symptomatic swimmers? Not that I'm aware of. The only thing you could do is potentially take temperatures at the gate, but that's going to require staffing and a thermometer. Michelle, are you aware of anything else?
No, but I do know that during like big crypto outbreaks like they had in Texas back in 2008, some pools did ask all the patrons to sign a form saying they didn't have diarrhea. I mean, one thing you might want to consider discussing with your attorney is, do people sign waivers saying they don't have symptoms of COVID-19 before going onto the deck or into the pool?
Okay. All right, next question is, where do we obtain ballpark for pool bather capacity? I think that's going to depend on the county that you're in and also what the official recommendations and the square footage that you have in there. So that's going to be on probably a pool by pool calculation that's going to have to be made. We supply towels to our members as they enter. Would it be recommended to stop this service until we get further into the phases? That's a great question. Michelle, do you have some input on that for towel service?
So right now, CDC is recommending that you wash clothing or whatnot, towels, at the highest water temperature recommended by the manufacturer, so whatever's on the tag, and completely dry that clothing. I don't know specifically if that applies to shared towels, but that's the guidance as it reads currently.
Okay, thank you. Next question is, if you have multiple lifeguards scheduled each day and you limit the number of bathers, can one lifeguard be used as a gate attendant? That's going to depend on probably facility by facility decision. As long as you've got adequate lifeguard coverage and you don't need that additional lifeguard, then yes, I think they could probably suffice or serve as a gate attendant, but it would depend on each, you'd have to analyze each community for that. Any new regulations on pool depth markers for Cobb County? Well, they need to be posted. I think they should be done permanently. If we can talk about that offline if somebody has a question about that. How often would you recommend cleaning, disinfecting bathrooms? I would say at least daily, if you can. I don't know, Michelle, if you have feedback on that as well.
The recommendation is frequently, so I can follow up on that. The website just says frequently. I don't know how they're defining frequently though, but I can follow up with you. I can check and follow up with you, Craig.
Okay, great. Is the pool phone still required in Georgia? Yes, it is. And then we have clarify a gym. I think what this person may be getting at is we have some communities that have a small workout gym as part of their amenities. That's different than, like, say, an LA Fitness Club or something like that. And so there's concern about those gyms opening up, I think is what we were talking a little bit about earlier. How do you get a pool cover if you choose to keep it closed? Your pool company should be able to quote and install a pool cover for you. Let's see. How to deal with arguments if they're not in the state or federal rules. I guess it depends on what the argument is. I would say, talk to your HOA attorney, talk to your pool company to try to get some guidance on that. How do we manage social distancing in restrooms? I think we talked about that. Basically, it would be dependent upon how big your restrooms are and if it would be safe to have more than one person in there. Otherwise, you could just have one in there. What are your recommendations for swimming lessons? That's a tough one. I was just on a call about that, and I don't know if Michelle, if you have anything you want to share from that call, but that's going to be hard right now. I don't know that I've recommend.
Yeah, so we're struggling with that at CDC. We're not sure what to do with that. Not all swim lessons are created equal. If we're talking about an individual, then that's very different than having 10 kids from different households. Mm-hmm. One idea we have floated around, and again, we haven't weighed in one way or another, we haven't made a final decision, is holding lessons for elementary age kids and preschoolers like you would for like an infant toddler class, where the parent is actually holding the child. So whoever's living in the same household is holding the child, and possibly having the instructor on the deck or somewhere where they can instruct the parent what to do with the child.
Mm-hmm. Yeah,
but again, everyone from each household would. Sorry, go ahead.
Yeah, I was just going to say that seems to be the most or the best option that I've heard discussed so far. And if you've got a kid who's already knows how to swim and they're doing kind of more of a stroke technique, that's a different situation. The coach doesn't necessarily have to be in there, but for learn to swim, the parents may need to assist for the best separation and social distancing. Okay, we have a question of, will Sears wipe down the furniture? We are talking about how to do that. I think we've got to figure out what the protocol is going to be on that. I think furniture should be wiped down. As far as how often and when it's going to happen, I don't know that yet. I think with most furniture being sitting outside and in sunlight, I think the assumption is that it's probably going to be safe from COVID-19. But Michelle, I would defer to you on that.
Yeah, I think what we've talked about is between users and coming up with a system where you would be able to tell when it was what's dirty and what's been cleaned and disinfected. And the key thing here with clean and disinfect, I would say that if there's stuff, whether it be suntan lotion or whatever's coming off of people's sweat, whatever, you need to clean the surface before you disinfect. Disinfectant is not going to work if there's just schmutz, dirt, whatever on there. You have to clean that surface first and then disinfect with chlorine, bleach, or whatever disinfectant approved by the EPA you're using.
Hey guys, really quickly, I just wanted to nicely interrupt. We keep getting a cascade of questions. There's a lot of duplicates, but we're already about 25 minutes past everybody's time period. If I could just ask the audience, I know that we've gotten Michelle on here. We're starting to see a lot of attendees drop. If we guys can get through the rest of the questions, it looks like we've got about 20 more questions, hopefully that can be answered. We do ask that you stop submitting any questions and just take these questions offline directly to Craig or myself. You guys are more than welcome to do that. This way we can get the presentation wrapped up, get your questions answered, and get all of this information disseminated out to everybody who's participated today. So go ahead and take these last few questions, and then we'll go ahead and sign off in about 5 minutes.
Okay, great. Thanks, Melissa.
Absolutely.
So the next question is, what is an acceptable chlorine level in the water and what is minimum? I think we typically like to run our pools between 2 parts per million and 5 parts per million. It depends also what the stabilizer level is in there. I think as far as when it comes to killing COVID, as low as 0.5, is that correct, Michelle?
We're not 100% sure. We know that on the studies that have been done with coronaviruses, that on surfaces, coronavirus is killed pretty quickly. So the levels we have in pools should be sufficient, what you would typically expect, 1 part per million or more.
Right. Okay, great. Since Fulton County has so many pools to inspect and so few inspectors, how long do you think it will take them to work through the inspections once they get the go-ahead? I wish I had a crystal ball to answer that. I don't know. It's that's going to cause some delays. I guess it depends on when they get a chance to catch their breath from what they're dealing with right now and when they start. So we'll have to see, but it will be weeks for sure, if not a month or more.
If I can quickly
Sure.
add something, just keep in mind that your pool inspectors are also restaurant inspectors, and they're also doing other inspections, and they're going to be out and making sure everyone's cleaning and disinfecting. So that might delay things even further.
Great point. Thank you. For pools that allow unsupervised, let's see. If a patron visiting the pool states that they contracted COVID-19 from the pool, how would you respond? Would that require you do anything more than what you do when you're normally cleaning? That's a good question. I mean, obviously you'd want to consult your attorney and start asking questions. I think you would want to do a disinfection, but Michelle, do you have any input on that as well?
Well, I'm sorry, I missed part of that.
Oh, the question was, if somebody claims that they got COVID-19 from the pool, how would you respond? I guess is what the question is.
I think one thing to consider, like you do with your pools, checking your chlorine levels and your pH, is document everything.
Yeah.
So you can go back and say, no, this was done at this time. This is how we did it.
Yeah. Clearly, yeah. If they're saying it came from the pool water and you can show that the chemicals were on point, then they didn't get it from the water. But could they have gotten it from somebody at the pool or a surface? Perhaps. It's going to be, that's a tough question to answer. But for pools that allow unsupervised minors with a lifeguard and a swim test, what are your thoughts on doing that this summer with social distancing requirements? Raise the age to 16 or 17, or don't allow minors with an adult present with them? That's kind of getting into an FHA question. Pretty much the advice that I've seen is somewhere between 12 and 14 is the minimum age that you can restrict minors from coming to the pool. Above that, they're considered that they can come to the pool without a parent. Restrooms must stay open and accessible in Fulton County, correct? We could not close them, I assume. Yes, they have to stay open. Should we take temperatures of patrons before entering the pool? What form of thermometer should be used? What if the patrons refuse? So that's going to be an individual decision for each association to make. If you want to do that, we'll be happy to talk to you about that offline. But if somebody refuses to take their temperature, I mean, you could refuse them access, but that you have the right to do that. Should operating change to protect swimmers? I think, yeah, I'm not sure how to answer that one. Should lifeguards have their own masks or fanny packs? So lifeguards do have a breathing mask if they need to provide CPR. As far as having their own mask, we talked about that earlier, that in maybe is kind of the answer I'll give you there. Are there any additional concerns for pools which are saltwater instead of chlorine-based? So saltwater pools are still chlorine pools and still have to maintain the same levels. Sounds like we need to develop our own policy or guidance for traversing areas where social distancing is challenging. The gates or entrance area, bathrooms and various surface touching grill areas, diving boards, ladders, railings, baby pool, etc. Yes, I would definitely encourage you to come up with some of your own regulations or guidelines to roll out to your members. How does an HOA without staff on grounds police all this? I think we've covered that. What is the recommendation on keeping the pool heated while it's closed? Would not do that. That's just going to make algae growth more likely. How does senior hours play into not restricting by age? So that's a good question. I don't know if we'll have senior hours yet. That's something I would ask your attorney. How does signing a waiver help with any carriers of coronavirus who are asymptomatic? Fair question. If they don't know, you can't say that you would blame them. I'm confused on stating the groups of 10 and groups of 50. How many people can be in a group? I thought it was 10 or 50 people, not 10 or 50 groups. So yes, it's 10 or 50 people in a group, but they still should be socially distanced. Would you recommend a restriction? Oh, lost that one. Yeah, just to be sure, groups of 10 for phase 1 and 50 for phase 2 must maintain 6 feet apart between groups. That's correct, right, Michelle?
So I think there's been some confusion about that, the numbers gathering, the 10 or the 50 or whatever. And I have to admit, I was not clear on it either. It came up in a conversation at CDC. So when you think about it, our grocery stores, we don't have limits of 50 people. It's people are going in there and doing their thing. There's employees there. The thinking there is it's 50 people aren't going together to go shopping together. People are going there individually. When we're thinking about these gathering limits, it's more about concerts and festivals and things like that. It's not so much about the grocery store. So in some ways that the 50 doesn't apply. It's not a gathering. So I would say it this way. You can, if for example, and I don't know what Georgia's limits are because everyone's doing things differently. If Georgia limits gatherings to 50 people, 50 people cannot have a pool party. However, 50 people could potentially go to the party as long as they're distancing from people in whose household they don't live with, and with people with whom they don't live with. Just to confuse everything even more, but just try to keep that in mind.
So to clarify, like a lot of communities like to do big opening parties or luau's and stuff like that. That would not be a good idea right now.
Exactly.
Yeah. Are you aware of any group, CDC, PHTA, providing a recommended daily opening checklist for ensuring gates and railings, et cetera, are cleaned? I'm not aware of a checklist being provided yet, but Michelle, are you aware of anything in the works at CDC about that?
We don't have a checklist. What we're trying to do is we're trying to come up with guidance that applies to all the pools in the whole country. Mm-hmm. CDC does not have a position as to whether or not public pools should be open or not. That is up to each state and local jurisdiction. What we are doing is saying, if your governor, mayor, or whomever says you can open up your public pool, these are things you should be thinking about. It's really sticking with the pillars of preventing COVID, the cleaning and disinfection, the wearing the mask, the frequent hand washing, and the social or physical distancing, and trying to fold that into the way you're already doing everything else you need to do to operate and manage a pool.
Mm-hmm. Okay. Question from a property manager who manages a large HOA with 1,900 homes. Since pool monitors and gate attendants don't have to be certified, what would be your opinion of opening with a monitor or gate attendant until guards are available? I would definitely consult with your pool company about that, depending upon the types of features you have and how that, how safe that would be. We are looking into something like offering personal training or one-on-one. Okay, I'm not sure what that is in reference to. What are the recommendations on keeping the pool heated while it's closed? We talked about that. How senior hours, I'm not sure what that would look like yet at this point. Are the communities required to provide cleaning supplies and sanitizer? I don't think there's a requirement. I think that is just something that we're recommending would be a good idea if you can and you can get your hands on them. Will each pool community receive an email from Sears with the details that aren't provided here? Well, that you'd have to contact us, right? We don't have an email we do have newsletters that are going out about this, but I'm not sure if the person asking that is on our newsletter list. Why not ask users to clean, disinfect before, like in gyms? Yes, I would love to do that. I think it would behoove all associations to tell their members that a good idea would be to bring their own cleaning materials to the pool when they come. I think that would be very smart. Michelle, do you have anything to add on that?
Yeah, I would agree with that. I do know in our parks recommendations, CDC says that just in case there's no hand washing soap and there's no water or soap for hand washing, to bring your own alcohol-based hand sanitizer. So yes, I think that would fall in line with currently posted recommendations.
Cool. Great. I think we have reached the end of the questions. Obviously, this was a well-attended event, and Michelle, thank you so much for your time and help in answering these questions.
Thank you for having me.
Yeah, Melissa, thank you for putting this on and organizing it. And Josh, too, I know you're in the background there.
Awesome. Excellent. Well, we really appreciate everybody joining us today, and we hope that your schedules have accommodated this really lengthy topic. But obviously, this is very clear, Craig, that this is on the forefront of everybody's mind. We all have questions, and I'm sure, like we said earlier, this content is going to continue to change. So we do appreciate you offering your time to even just organize this information and produce it for us. Michelle, we do really appreciate you joining us, and we're sorry that you've experienced any technical difficulties in joining on, but we do really appreciate the time that you've spent with us today. We are going to go ahead and wrap up for the afternoon. I will be disseminating this recording later on this evening, just depending on how quickly they can go ahead and get it to me. And I will go ahead to anybody who has signed up for this link. I will email all of you the slideshows so that you can have them and share them with your communities as well. So thank you again for everybody who attended today, and we hope that you have a wonderful day.